Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss how to get up from a low surface or a low chair independently and safely, either before or after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, exercises, frequently asked questions, rehab and recovery, and everything else. So these techniques and these strategies are really going to apply for getting up from any chair, but of course the lower chairs are the ones that you're going to have a little more difficulty with, but it applies for getting up from a low bed, getting up from a toilet seat that's lower down. All these techniques and strategies are similar and will benefit you and help you. So first of all, if you have some sort of upper extremity support, so if that is the armrests in a chair, if you have grab bars in a bathroom, whatever that may be, that can really just give you that extra little boost that you need to get up from a low surface. Now if you don't have those available, I don't recommend, if you have a walker, to pull up from the walker, because what you see is people will try to get up from the walker and that walker is not stable. That walker, you can't pull your body weight with that walker, and what can happen is as you're trying to pull yourself up, that walker is going to come back and you're going to plop backward potentially. So I don't recommend that. If you don't have any armrests or grab bars, what you can use is, I always recommend putting your hands down on the sides of the chair or the sides of the toilet or whatever it may be to kind of push up from that part and give yourself a tiny bit of that upper extremity support. Now, before you even go, the setup is probably just as important, if not more important, than the actual standing up. So first thing is you want to scoot yourself forward as far as you can. You want to have a good chunk, probably 2/3 at least, of your thigh past the edge of the chair or the surface that you're getting up from. And this is all about kind of mechanics and getting as much leverage as you can. And then what you want to do is you don't want your feet out here in front of you. Again, you want to be able to use those levers, use those mechanics. You want to slide your feet back so they're kind of back underneath and behind your knees. And you can be up on your heels a little bit too. That's okay. And then what you're going to do is, sitting up nice and tall, you're going to use the weight of your body. You're going to use the momentum of your body. So you don't want to do this, crouch over and try to push like this, but you want to keep a good, more or less neutral spine position, and you're actually going to hinge at the hips like this. So you're going to have your hands down here, you're scooted forward, your feet are back, and you're going to hinge forward. And the common phrase that probably every physical therapist out there knows it, is nose over toes. So you want to bring your nose forward over your toes. And basically what that's cueing you to do is hinge your hips, hinge your torso forward over your legs. And so a lot of people might try to stand up from here. That's going to be a lot more difficult. Hinge forward, push yourself up from here, and then hopefully you can push yourself all the way up. Now, some people still might have some difficulty, and this is where we want to take advantage of some momentum, a little bit of power. Just make sure that you're safe with this and as controlled as you can be. So for example, instead of just doing this and trying to push right up, what you can do is I'll have people do kind of like a count of 3, and you'll rock. So 1, 2, 3, push right up and try to come and stand up. And you really want to think about using that momentum to, I tell people, explode up like you're a rocket ship. You're trying to push all the way up and bring your head like you're going to hit your head right on the ceiling. If you could, you would come up so quick that you would almost jump up and stand. It's really that, using all the force, all the speed, all the power that you have available to you. So again, get that good setup, forward in the chair, feet back, hands somewhere where you can hopefully get a little bit of a push, Do that rock. 1, 2, 3, and then just explode up as fast as you can. Now obviously if you have some strength deficits, that's going to be a little bit slower, but just that initial movement of it and just sticking with it, just push, 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 hopefully that will give you the momentum and the strength that you need to get up from whatever that surface is, if it's a toilet or a low seat or wherever that may be. Now of course, hopefully this will get easier and easier as you progress in your rehab and recovery, as you build strength, as you build range of motion, as your pain and symptoms are more and more manageable. But this is just a strategy that if you find yourself in a situation where you need to be able to get up, it's good to be able to do that. So thank you very much for watching, everyone. Be sure to leave your questions below, your comments below, and I'll be sure to get back to you. And thank you again.